My name is Juliet, and I'm a certified community health worker with the Macoupin County Public Health Department. And during Child Abuse Prevention Month, we recognize the many ways that children can be supported, protected, and nurtured. One important part of that work is understanding how early experiences affect children's health, behavior, and emotional well-being. Today we're joined with Kristin Bowler, a licensed clinical social worker, who will be talking with us about adverse childhood experiences, or ACEs, and how parents and caregivers can support children in healthy, positive ways. So Kristin, can you start by explaining what ACEs are and why it's important for caregivers and parents to understand them?
Yes, so ACEs are a research-based way to understand difficult or traumatic events that when we experience them as children, they can impact us into adulthood. And so there's been a lot of research done on ACEs, and it helps to provide information on how that trauma experience in child impacts health outcomes, including mental health, emotional health, brain development. And so I think about it as caregivers and parents, we're trying our hardest to provide the best care we can for our children, and so understanding what ACEs are can help us identify the kinds of life experiences that could have a significant impact on a child and help us get this child support, like counseling, for example, sooner rather than later, if that's something that a child we know has experienced.
So, what are some common examples of adverse childhood experiences?
So I'm going to go through the ACEs categories with you. So there's kind of the top 10 ACEs that if you're doing a screener about ACE on behalf of your child, or even if as an adult you're looking back on your own childhood, these are the things that research has shown can kind of result in some of those health outcomes we're talking about. So from a kid's perspective, you would ask a kid, as a parent or adult in your home, do they swear at you? Do they put you down, insult you, act in any ways that make you feel afraid or scared that you might be hurt? So that would be any kind of emotional abuse. Does a parent or adult in your home push you, grab you, or hit you? Any kind of physical abuse. The third would be, if a kid says anything about being touched or harmed in a sexual way, so any kind of sexual abuse. Emotional neglect, and I like this description, right? So it would be if you were asking a kid, does it ever feel that no one in your family loves you or thinks you're important, or do you ever feel that your family doesn't look out for each other? Number 5 is around physical neglect. So with this, we think about if a kid's talking about not having enough to eat, wearing dirty clothes, no one's taking care of you or protecting you. The 6th one, any kind of loss of a parent or a caregiver. So this could be, of course, if there's a death of a parent or caregiver, but also divorce or any kind of abandonment that happens, kind of losing that primary person in their lives. The 7th ACE is related to witnessing domestic violence. So oftentimes we would ask a child, do the adults in your home ever hit, punch, or threaten each other? If a household member has a drug or alcohol abuse issue, so just asking, does anyone that you're living with have a problem with alcohol or drugs? Having a household member with mental health issues, so usually we kind of be asking the child, are you living with a household member who was depressed, who was mentally ill, who was attempted suicide? And then the 10th ACE is around if a household member who was in prison or incarcerated, which I think sometimes can link also to that, just if they weren't able to be present as a caregiver.
So now that we know what the 10 ACEs are, can you describe a little bit of how common these ACEs are and why it's important that we talk openly with our families about them?
Yeah. We have a lot of research about how common ACEs are. So the CDC has done a lot of research, and I found these two data points that I thought were interesting because one talks about that when adults were reporting ACEs, it was 63% of adults reported at least one ACE, so experiencing one of those things that we talked about, and 17% reported experiencing 4 or more. Then they did another study where they asked teenagers how much often they have experienced these, and that study found that 76% of teenage students, high school students, reported 1 or more, and 18% reported 4 or more. And the most commonly reported were emotional abuse and physical abuse. So I think that kind of helps when we're trying to think of what are we most likely to see kids dealing with. And I think talking about it openly with families just helps all of us increase our awareness about what risk factors are and opportunities for interventions and support, as well as just increasing protective factors and resiliency when we can. I'm a counselor, so the more we're talking about things, I think the better, and the more we can help families find resources and help kids find support they need. And even as adults who've gone through this as kids, I think can still find a lot of resources and support for healing.
So we know that ACEs can affect children in their childhood, but let's talk about that long-term future effect, the ACEs within adulthood, or how it affects our futures. We see from research, 80% is a higher odds of smoking, or a high ACE exposure is about 27% of individuals who experience that substance use or abuse. So could you talk a little bit more about how that affects our children into their futures?
Yeah, I think oftentimes this is what really connects for people with the ACEs, is it's not just the emotional health that's affected, but like our physical health. So like obesity, early death, ACEs are associated with significantly higher rates of premature mortality due to the chronic disease and health risk behaviors. And I think especially if you've experienced ACEs, you've experienced multiple ACEs, and then what happened next? So if you experienced it and then your body didn't get to have that healing and integration and was in a fight or flight or response the whole rest of your life, right? Like that is going to have chronic health effects. And so I think the more that they're screening ACEs across different fields, like when you go to a doctor's office and they ask you these questions, we're getting a lot more data on it than only it getting kind of noticed by people who've gone to therapy support. Seeing it as a medical health outcome, I think, is also helping people understand that it's what they've been through has impacted them. But I love the flyer that we hand out, talks about children can be hurt, but they can also heal. And I think that part of just because you've experienced one of the ACEs or multiple doesn't mean that you are destined for these horrible health outcomes. And also, you might, if you're having some of these health outcomes, it might be worth looking at kind of what you went through in childhood and if there's anything that could be helped in the here and now for adults or kids for recovery.
Now that we understand how ACEs can affect childhood and adulthood, how can we build those supportive relationships and resilient children in childhood to prevent these outcomes?
So what we know is that the presence of a protective adult diminishes the association between the neglect and adult health outcomes. So adults who experienced neglect but had even just one supportive adult in their life at all reported less depression than those who did not experience that. And so the findings suggest that really like the positive relationships we can foster create a resilience in adulthood. And so I think about that, where anytime a kid is experiencing any kind of a positive, nurturing, safe, warm relationship, even with a single supportive adult in their life, that's going to help build resiliency. So as parents and caregivers, we get the chance to be that person.
Mm-hmm.
And if we are in a helping profession or in contact with children in our daily lives who may be experiencing ACEs, we can still be that supportive person. That's one of the things when I work with adults, when we're talking about, okay, which of these experiences did you have as a child, but also who would you go to if you were feeling scared or you were feeling hurt? And the people who can be like, oh, but there was somebody I could go to, the resiliency they have that can build from that is tremendous.
So as we wrap up, I want to give a big thank you to Kristin for taking some time and sharing her knowledge, her wealth of knowledge on ACEs, and for joining us to help parents and caregivers understand what adverse childhood experiences are and how it can help support your children as they grow. It's important to remember that ACEs can have an impact. Positive relationships, support, and stability can make a powerful difference in children's lives. Parents and caregivers do not have to have all the answers all the time. So showing up, providing safety, consistency, and connection are all ways that we can help our children heal and thrive. So thank you for taking the time to learn more about how you can support your children, your families, both emotionally and mentally in all of their well-being. All available resources that were mentioned in our conversation, including statistical data, will be linked at the end of this video. And again, thank you so much to Kristin for spending her day with us and also for taking the time to learn a little bit more.